Welcome to yet another edition of COVID-19. I'm Min Sun-hee. The recent torrential downpour here in the metropolitan area has been flooding homes, disrupting traffic and aggravating concerns amid the pandemic. The government, for its part, is seeking to better address the psychological impact of the latest state of dismal affairs on the public. And I have our Kim Mo-gyeon later with details on that. But first, here is our Kwon So-ah with details on the pandemic. So-ah, how are we starting this Thursday here in Korea?
Well, Sunny, this Thursday, the country reported more local infections than imported cases, and that for the first time in almost 2 weeks. In fact, we have 23 local infections and 20 imported cases. That means today's caseload is at 43, raising the total to 14,499. The death toll remains at 302, while we have 696 people in quarantine, with 52 less than yesterday. That means we are down to below 700. And we also have 95 new recoveries, raising that total to 13,501. And with that, the recovery rate here in Korea stands at over 93%. Let's move over to our graph now. We do see we had a decline here earlier in the week, but now we are seeing a rise again. And for the first time in quite a long time, we are back to the 40s. And if we go over to our map now, we have cases concentrated in the metropolitan region. In fact, 16 imported cases in the Greater Seoul area, and that also includes 7 cases that were reported in Gyeonggi-do Province's city of Goyang, where a patient is believed to have spread the virus to family members as well as colleagues. And we also have sporadic infections in and around the capital Seoul related to offices, restaurants, religious gatherings, and more. Also, we see some 3 new cases which are local infections here in Busan as well, and 6 cases were reported at the nation's airports or seaports this Thursday. And now let's get a check of the figures abroad. The total number of infections stands at over 18.97 million, and the death toll at 711,000, and some 12.16 million recoveries. Let's take a look at the major outbreaks around the world now. The U.S. here at closely at almost 5 million now, and India at almost 2 million. And the death toll has also surpassed 40,000 cases. But of course, that's the official death toll. As many reports say, the actual death toll might be much higher. And that also goes for a country on our next table. Here in Iran, the death toll stands at 17,802 now. But recent reports say the actual death toll there is at over 42,000, which is a big concern. And also many Latin Americans are having still surging numbers, especially Colombia at 345,714 cases, which also reported around 10,000 new cases in the past 24 hours. And those are the figures I have for now, but I'll have more updates after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. More than 6 months into the pandemic, and among quite a number of people, feelings of anxiety and uncertainty are growing persistent as concerns of contagion keep them confined to their homes and their activities restricted. For more on the coronavirus blues, I have our Kim Mo-gyeon here in the studio. Welcome, Mo-gyeon.
Hi.
Mo-gyeon, do start by telling us about the presence of such cases worldwide.
Well, the COVID-19 pandemic is not only threatening the public's physical health, but also posing threats to their mental wellness. The fact that we cannot meet up with friends, get proper exercise, or go any place without wearing a mask is a stress factor for many people around the world. If we delve into the figures, the San Raffaele Hospital in Italy held an analysis on some 400 patients who recovered from COVID-19. They found that 28% of them were suffering from post-traumatic stress or disorder, and 31% have shown signs of depression. Nearly half of the respondents also said that they are experiencing anxiety and insomnia. Sadly, many young children also struggling to keep a smile on their face. Data from Save the Children, an international charity organization, showed that nearly 1 in 6 Spanish children were feeling depressed on a regular basis throughout the pandemic, especially those from low-income households. The survey was conducted on nearly 2,000 households in Spain, and among the most vulnerable households, results showed that 17% of children reported feeling depressed often or daily, while more than 30% of children struggled with insomnia and 30.1% showed signs of anxiety.
That actually is really sad, Mo-kyun. What's the situation like here in Korea then?
Well, it's more or less similar, sadly. A pair of studies held by the Korean Society of Traumatic Stress Studies in March and May showed that twice as many Koreans were reporting symptoms of depression compared to last year. Participants were asked to grade their level of depression from 0 to 3 in 9 different criteria. And if you take a look at the chart, average depression score of respondents in May rose to 5.12 from 5.1 in March, and that figure is double that of 2018. One thing to note is that the depression score of people in their 20s was the lowest among all age groups during the study in March, but in May it became the second highest. Their murky future was attributed as the reason, with many people in their 20s now at a stage where they have to make life-determining decisions amidst uncertainties stemming from the pandemic. And separate studies held by the Child Fund Korea on more than 40 children aged 7 showed that some 70% were living in fear of COVID-19. The Chungwon Regional Youth Center in the city of Seongnam also asked teenagers about their pandemic, and nearly half of them said that they feel suffocated and irritable.
So how can we tell if you're suffering from the so-called coronavirus blues, Mo-kyun? What are some of the symptoms?
Well, most of the symptoms are similar to those of depression. They include weariness, insomnia, feelings of sadness and isolation, and the loss of appetite. Other symptoms include low self-esteem, self-loathing, or feelings of guilt. But an expert in the industry says we don't have to worry too much because sometimes these feelings could be temporary.
Most of the times when psychological symptoms appear amid an infectious disease outbreak like COVID-19, they disappear within a month. But if they continue, they could develop into an anxiety disorder like PTSD. So if symptoms do not disappear even after some time passes, one needs to see an expert.
And the government is also aware of the issue and vowed to look after the mental health of the public alongside their physical health. Let's take a listen to the Prime Minister's remarks.
As the COVID-19 situation is becoming prolonged, concerns have been raised over more people suffering from depression, insomnia, and panic disorder. The government will work closely to look after the public's mental health.
Well, that is comforting to know, Mo-kyun. Could you tell us more about the government's plans to this end?
Sure. The government is planning to provide more support for psychological consultation services for citizens who've been suffering distress from the COVID-19 pandemic. The Ministry of Public Administration and Security said that it has revised its criteria of who would be eligible for government-funded counseling. Before, only disaster victims and those who participated in relief efforts were entitled for the support, but with the changes, anyone deemed to be in need of the therapy have become eligible from Tuesday. Those who would like to receive counseling can contact their city's respective disaster psychological recovery support centers and also call the KCDC and the Mental Health Welfare Center's hotlines for inquiries.
Right. Now, Mo-kyun, before you go, do you have any words of advice for our viewers about how to keep above the weather, so to speak, amid the pandemic?
Well, yes, I do. Experts actually say that it's really important to have a balanced diet and also get enough sleep. Since many citizens are staying indoors due to the social distancing guidelines, they recommend people to open their windows and get some fresh air and sunlight. Though it's difficult to have gatherings and meet friends, people are advised to stay in contact and share their thoughts and feelings with others, be it through online or a phone call.
Oh, I see. So be psychologically close then. All right, Mo-kyun, thank you very much for that. Hope to see you again soon.
My pleasure.
Right, it's time now for the regular afternoon briefing on COVID-19. Korea recorded 43 new cases on this Thursday, as our Kwon So-ah reported. And here we have the briefing. We'll come back to you afterwards.
Let us begin our regular briefing for the COVID-19 situation here in South Korea for August 6th, Thursday. As of today, midnight, we have 23 new local infections and a total of 20 new imported cases. The total number of confirmed cases now stands at 14,499. 95 more people have been discharged following full recovery, while a total of 696 people are in quarantine. The number of patients patients with severe or critical condition stands at 18, and the death toll remains unchanged. Here are some updates on our major domestic infections by region, starting from Seoul City. In relation to the Love Church in Songpa-gu District, Seoul City, we have one additional case, and a total of 22 cases have been confirmed to date. And in relation to a coffee shop in Gangnam-gu District and a restaurant in Yangjae, we also have two family members of the previous case being confirmed, and a total of 15 have been confirmed to date. And in Gyeonggi-do Province in Goyang City, in relation to a Joy Church, we also have the first index case, and we have identified 7 new additional cases, and the total now stands at 8. And in relation to this church in Goyang City, as the risk factors, it is located at a basement floor of a building, meaning that they did not have a ventilation or windows. And after the regular service, they gathered together for dining. And next, moving on to Chungbuk Province, Cheongju City, we also have, aside from the 6 people who have been confirmed, we do not have an additional case as for the Muslim worship service. And we are looking into the Muslim worship service as well as all of the 336 people have been tested, and all of them have tested negative so far. We are also doing in-depth epidemiological investigation on the source and roots of infection. And in relation to the imported cases today, we had 20 cases. 6 of them have been reported at points of entry, and the countries are as follows. 7 were from the America, 5 from the US, and 11 from Asia, excluding China, and 4 from Russia, and 2 from Uzbekistan. Here are some updates on our R&D for the treatment, and we have also a total of 1,150 people who have extended their intentions to donate their blood plasma samples, and over 727 people have also actually donated their samples. We extend our deepest gratitude to all of them. And as for the remdesivir, it has been administered to a total of 117 people with critical conditions nationwide. And as for the antibody treatment research that we are carrying out, we are doing the secondary phase 2 research right now. And centering around the Daejeon and Sejong, also we are seeing we have a total of 1,080 samples that have been collected, and we will going forward finish the secondary testings on the public antibody by the end of August. And this is aside from the public nutrition survey, and aside from this, we will also conduct in-depth analysis and studies on the other regions that were not included in the first round of the testings, and we are also collecting and accumulating the samples from the general public. And next are some of the matters for the life quarantine measures. And as for the safety ministry, it is currently operating the safety e-report, and we have some reports of the breaches of quarantine measures. And at door-to-door services facilities, they did not wear face masks, and they carried out business promotional sessions with over 30 to 50 participants. And also there were other sessions and other training sessions where people did not wear face masks and did not keep distancing, and they kept in a long line for over 2 hours. And at establishments like entertainment establishments, people did not wear masks properly while they were closely located in line waiting for entry. And also wearing face mask is very important to protect yourself from the droplets of others and also from spreading your infectious droplets to others as well. So if you are at indoors, which is difficult for you to keep 2 meters of distance, it is mandatory for you to wear face masks. And if you are at outdoors, if you cannot keep 2 meters of distance, you should also wear face masks as well. And when you are wearing the face mask, you should cover both your nose and mouth, and you shall not touch frequently the surfaces of the masks, and always wash your hands thoroughly before and after touching these face masks. And the KCDC also highlights multiple times that the COVID-19 spreads at any time when it is a closed, crowded, and close contact environment, so-called 3C environment. So we ask you to postpone or delay or cancel any of your gatherings as well. And please refrain from going to crowded and loaded places. And next, we have some updates on the heavy downpour. We first of all would like to extend our deepest condolences to the deceased and the members of the bereaved families, and we also send words of comfort for the hundreds of the people who have been evacuated. And also it is very important for us to spread any infectious diseases from this point on, and after your homes have been flooded, your food that has been stored inside the refrigerators are not safe to consume. And also, if your house has been flooded, it is very important that you wash your hands and with soap and running water after touching the flooded water as well. And also drink from the bottled water or packaged water only instead of drinking from tap water as well. And when you brush your teeth and cook, you should also use bottled and packaged water as well. And as for the temporary shelters, we are also providing detailed quarantine guidelines for these shelters. And to prevent the spread of the COVID-19, we ask you to wear face masks, wash hands, and keep a 2-meter distance from others. Last but not least, here are some of the aspects that we would like to highlight during our briefing. The global COVID-19 pandemic is being prolonged, and many countries have seen changes in their quarantine measures. I believe the biggest aspect was the wearing of face masks. And most representatively, some advanced countries which did not proactively wear face masks, they are also mandatorily complying everyone to wear face masks even when they are at homes as well. And especially when they have people with chronic illnesses or people with seniors above the age of 65, they are highly recommending that all house members should also wear face masks. And we have highlighted multiple times that the only effective way to prevent yourself from the COVID-19 is wearing face masks and keeping distancing. And we can see from the cluster infections at a coffee shop in the Seoul city, as well as a camping site in Gangwon-do province, Hongcheon, we have identified that the people did not wear face masks properly. If they had worn the face mask properly, we believe that we could have minimized the risks of infection. And thus it is very important for you to wear face masks at all times, at any times as well. And even when you are at the same locations, when there are people who are on self-quarantine, both of you should wear face masks at all times. And once certain countries are also having some actions and campaigns to secure an access to vaccines, and the country of Korea, we are also carrying out our guidelines to secure these vaccines as well. And we are opening our ears to those of the experts, and we are also monitoring the situations and other conditions overall. And at this point, we would like to once again highlight is the following. In relation to life quarantine measures, even if there are sufficient amount of COVID-19 which has been proven effective, and even people have been vaccinated, we would like to stress that nothing will be changed. So in other words, even this time comes, wearing face masks, washing your hands, and keeping 2 meters distance, and also abiding by hygiene measures should be complied by going forward as well. And we would like to ask the public to remember that no vaccines can perfectly prevent you from the COVID-19. And we would like to highlight that even after the vaccine development, if you become complacent against the virus, you could also be open to the risks of COVID-19. We believe that the issue of COVID-19 will not end this year, and we believe that this will be prolonged and lingering for the years to come. And we believe that wherever you are, all of the human race will be exerting their full efforts to contain the COVID-19 going forward. And even if all of our world public is, and only when the world population is fully vaccinated, we can see that we can say that we will have an end to COVID-19. However, it is very difficult for us to expect and forecast when this day will come. Therefore, wearing face mask and 2 meters of distance keeping should be our new norms. As we bring and take our wallets and smartphones when you go outdoors, going forward, it will be very important for us to wear face masks even we step outdoors. And if you are with others, you need to always wear face masks as well. The quarantine authorities will always stay vigilant and monitor the situations going forward. And we will also carry out in-depth tracing and treatment as well to curb the spread of the COVID-19. Thank you very much.
기자님들 질문에 답변 드리는 시간 갖겠습니다. 각 조사가 진행 중인 내용에 대해.
Right, that was Kwon Jinuk, the Vice Head of KCDC, with Thursday's afternoon briefing. So he's highlighted the importance of wearing face masks.
Right. It's one of the most simple but also the most important measures that we should keep on abiding by. And that can be seen in a recent case in the capital, Seoul, where we had some 15 infections linked to a coffee shop and also a restaurant. So that's 2 more compared to yesterday. And although this is not, that's not a big number maybe compared to other outbreaks, we can see how this case shows that if you do not wear your masks properly, this can lead to many chain transmissions because these people at the coffee shop were said to have not worn their masks properly. But if we take a look at a case in Chungcheongbuk-do province where more than 300 people attended a Muslim prayer, we had really big concerns yesterday that this could lead to a massive outbreak, but it looks like no additional cases have been reported as of today. So I don't want to make a pre-assumption, but maybe that is because people did abide by wearing face masks. So that is why this is important. And also, as we are seeing heavy rainfall here in the country, Kwon Jinuk, the Vice Director of the KCDC, stressed to also take care of personal hygiene measures, especially if you're at any of the temporary shelters, and also make sure to drink clean water and also clean food, so to prevent other diseases as well as COVID-19.
All right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
Hygiene practices have become a priority at public establishments and facilities amid the raging pandemic. In this next report, we take a look at such efforts.
Local hospitals are taking strict measures to prevent an outbreak of COVID-19 at medical facilities. Cluster infections have previously occurred in several hospitals, and as a result, many citizens are still hesitant to visit these facilities. This hospital has installed air showers to prevent the spread of COVID-19 among its patients.
요즘 코로나19로 인해서 병원에 오시는 걸 두려워하시고 꺼려하시는 분들이 많습니다. 특히 물리치료 등 원내 체류 시간이 긴 정형외과는 더더욱 그렇고요. 그래서 근심하는 환자분들의 걱정을 조금이라도 덜어드리기 위해서 이런 기계를 준비하게 되었고요.
The chamber uses high-pressure air to remove dust and germs. In addition, an air curtain goes into operation when a person walks in, blocking harmful substances from entering the building. LED sterilizers installed on each side disinfect the air.
먼지도 날려주고 바이러스도 없애준다는 얘기 들으니까 안심은 돼요. 없는 것보다 훨씬 낫다고 생각해요.
This is a public library in Seoul's Seongdong-gu district. This library has put strict measures in place to prevent any infections. These are book sterilizers that library visitors can use to make sure the books are clean and disinfected.
저희가 공공도서관이다 보니까 불특정 다수가 오셔서 책을 다 만지실 수 있으셔서 또 도서관 열람 시간 내에는 다 보실 수가 있는 지금 그 단계적 개방으로 하고 있어서 저희 그 마지막에 빌려 가시는 분이 최종적으로 소독기에 각 열람실에 비친 소독기에 소독하고 가져가시고 계시고요.
Running fans inside the book sterilizers remove the dust, and UV rays are then shot onto the books to kill any viruses and fungus.
책이 여러 사람들 손을 거치는 거다 보니까 좀 찝찝할 수 있는데 이렇게 소독기가 있으니까 좀 안심하고 책을 볼 수 있게 되는 것 같아요.
It's August, and that means it's vacation season here in Korea. This is usually the time to enjoy the sun and the great outdoors, but we have to remain wary of COVID-19. The coastal city of Gangneung in Gangwon-do province have even deployed drones to monitor its beaches. These drones will be in operation until August 30th and will keep watch over the visitors to ensure they're complying with preventive guidelines.
전 국민이 마스크를 착용하는 거라든가 거리두기를 모르시지 않을 거라고 생각해요. 근데 바닷가에 오면 더우니까 잘 안 지킬 수가 있는데 제가 들으려고 하려고 함으로써 일단은 사람이 할 수 있는 부분을 하게 되니까 좀 재밌어 하시는 분도 계시고 물론 어려운 시기지만 저희가 방역에서 최선을 다하고 있으니 국민이 최선을 다하셔서 즐겁게 해줘 가시고 그 대신에 방역 잘 지켜주시고 하시면 감사하겠습니다.
New and innovative tools are being employed to keep the country safe from COVID-19, now and in the future.
Elsewhere around the world, authorities in the Philippines have reimposed their lockdown in Manila as the country's total number of infections surges past 115,000. I have Nicamille Sanchez, a social worker in the Philippines, live on the line. Hello, Nicamille.
Hi, Sunny. How are you?
Fine, thank you, Nicamille. Officials there recorded a daily high of more than 6,000 cases this past Tuesday alone, with the majority of those cases in Manila, where you are. Please tell us more about the situation in the Philippines.
Yes, recently, the Department of Health have registered around 44,429 active cases, and we are ranked as number 2 next to Indonesia on the number of COVID-19 patients. And definitely there's cases of around 82.84% in government hospital has been occupied in their ICU units. So in terms of economy, we have 16.5% decrease in our gross domestic product. So technically we are on recession. In terms of the social and political aspect, there is an issue of corruption in the Philippine Health Insurance Company, and there is some miscommunication or misunderstanding among our medical frontliners together with our government.
Nicamille, in response to the surge, the government has reissued the stay-at-home order, which is seen to affect more than 27 million people there. What other measures are being taken to curb the spread of the virus in the Philippines?
First, aside from the government have made an announcement of a modified enhanced community quarantine starting last August 4 to August 18. So secondly, you could see a more presence of the uniformed personnel, security personnel in the streets. So the travel has been limited to only frontliners and medical services. And you see the issue of the government provided around 846 billion stimulus. And at the same time, you see stricter regulation in terms of wearing masks in public and suspension of public transport.
Nikamil, I understand the decision to reimpose a lockdown followed public words of concern by healthcare workers in the Philippines who claim that the medical system there is on the verge of collapse. How are they responding to the latest restrictions?
Yeah, you could analyze it based on anecdotal statement and statistics. So basically, in terms of statistics, you see that the government and private hospital is now on the verge of collapse in the sense that in terms of patient-to-bed ratio. And then secondly is there is some political or misunderstanding between the statements of the medical association and with the government that has been resolved. So the government have issued the necessary intervention, the enhanced community quarantine, to give some breather to our medical personnel for 2 weeks to rest, at the same time to have some time out in addressing this pandemic.
Nikamil, you're a social worker yourself. Please tell us a bit about your work.
Yeah, I am a registered social worker here in the Philippines. Firstly, we have organized the United Registered Filipino Social Workers that provide free confidential telephone social work counseling and psychosocial first aid to medical frontliners, to their families, and especially to the communities. So we try to look for the most vulnerable in our communities, listen to them, actively listen to them, and link them to appropriate government or private services like we are doing right now. So basically, we wanted to inform the Filipino people that that your mental health professionals like social workers are there for you. At the same time, we believe that all hands on deck. We should help the government in addressing this pandemic, and we need to stand united with different organizations and the government.
All right, Nikamil, all the best to you. And again, thank you very much for making the time to join us live with your thoughts.
Thank you so much, Sunny. Take care. Stay safe.
예전처럼 모든 학생이 이제 학교의 전체가 같이 모여서 생활하고 있지는 못합니다.
COVID-19 has ushered in an era of e-learning, and this in turn appears to have widened the educational divide among young scholars worldwide. For more on this reality and on ways to better address it, I have Professor Lee Ho-kwa from Chungbuk National University. Welcome, Professor Lee.
Hi.
And I also have Professor Kang Kyung-suk from Wongang University. Welcome, Professor Kang. Professor Kang, we'll start with you. Let's begin with the changes brought on by the pandemic in the global academic arena.
So education scholars are unison. The education sector needs digital innovation, which will transform total whole sectors. Actually, we talk of a revolution in education. Why? Let's look at the impressive figures. As a member of the Korean Committee of UNESCO, I am familiar with relatively the UNESCO figures. As of April 2020, 185 schools are closed around the world. And 91% of students no longer attend school because of the spread of COVID-19. Save the Children NGO, active in Korea, reports that 1 million students worldwide are deprived of school education due to the spread of the disease. So in this situation where physical context should be avoided, online education has not only become fashionably but also a necessity. However, this poses challenges for the digital infrastructure of states. as well as for the teachers who should adapt new teaching methods in school. But just showing a video is not online education.
Right. Professor, Korean schools began their semesters online back in April. How do you assess their achievements thus far?
When COVID-19 broke first, schools closed. It means education stopped. Nobody knew how long it would stay and how serious it can be. COVID-19 continued, but schools cannot keep closed. So the schools opened even during, because we have a history that schools opened even during the war. Education stopped in March, but education opened in April using online learning. Of course, at the beginning of the online learning, the technical problem was serious for about 1 month. EBS carriers expanded their server very quickly to serve the educational platform. It was possible as their server were already turned into a cloud system from the previous year. Contents were provided by EBS and carriers, but students wanted to see their own teachers in the contents. Teachers quickly formed professional support group and learned how to develop their own instructional materials. After COVID-19 became under control, schools opened for physical classroom teaching. Schools continued to use both online and offline teaching carefully. I think we managed to continue education well within these unexpected circumstances.
Right. Professor, there's also much talk about how the digital divide is triggering an educational crisis because remote learning depends on access to the internet and a laptop, of course. What are your thoughts on this?
Yes, the educational gap is an issue for online learning. From the survey done this June, 6 out of 10 adults agree that the COVID-19 protraction caused the education gap. During the preparatory test done in June this year for 2021 SAT, it was shown that the gap between the upper quadrant and the middle quadrant became wider. In English test, more students belong to the first tier than last year. The middle group, 2 to 4 tier, all decreased. This academic performance becomes the shape of hourglass. Through the online education, we learned that top-tier students manage their learning well regardless of the circumstances, and the students from affluent families make up the learning deficits by private tutoring. Also, it is noticed that the middle-tier students decreasing. That is a cause for polarization in academic performance.
Right. Professor Kang, I understand the gap in education is particularly pronounced among those in the less privileged brackets. Could you tell us more about that?
Indeed, the socially vulnerable families suffer twice. Children have to learn how to follow online courses. Therefore, they need the explanation, supervision, encouragement, and special care provided by the parents. But the vulnerable families is a kind of lacking in that situation. So, and secondly, there are severe social implications. Family budgets are strained, so it's not easy to equip a very good the personal PC for e-learning. I mean the PC, and the suitable networks is very costly. So the students and the disabilities are in a very difficult situation. Tentatively, it's very, the attention span is tentatively become very short whenever they got online courses. So, and it should be follow online classes productively, but it's not easy. So their children are struggling. And their children also struggling when their children have disability. I mean, the physical disability, it's make very difficult to handle computer properly, and and visual impairment and cognitive problems, and with the challenging behavior, should not easy to access online courses. So it could be make the parents struggling. So I think the parents are very struggling should not be alone. I think. Okay.
Right.
Especially when a family has many problems, I think.
They need more assistance then, of course. Professor, aside from the necessary access to digital platforms for e-learning, what might be some other reasons for the gap in education?
There are many sources for educational gap, and the biggest limitation for that is the lack of learning time. Learning time can be secured at school efficiently by providing curriculum, timetable, classroom activities, and so on. But care and management for students' life is also a source for securing their learning time. Now the responsibility for care and management all turn to the family. So family has the whole responsibility for keeping the learning time for their students by providing the proper care and management. And also the Korean students have a very poor learning environment at home. According to the OECD report done in April this year, 1/4 students do not have a quiet place to study at home. That can cause also the lack of learning time. We have to find ways to protect students' learning time.
I see. So better time management is very important then. Professor Kang, here in Korea, the shift to online learning has also led to other problems, including that regarding the upcoming college scholastic ability test. Tell us more about that.
Yes. Since the school has reduced the hours of classes, it will be difficult to treat the whole curriculum, I think. As teachers probably didn't have enough time, there will be some subject which did not get full attention. In addition, the third grade high school students, I think for the college entrance examination, they can feel very fear comparing to those who retake the entrance exam. So, I mean, that is called the repeater. So the students who cannot cope with online courses, they'd like to get another courses in private institutes. They'd like to reduce their fear and try to catch up. Therefore, there is a growing demand for that kind of a private institute. And another problem is that attending private institute exposes students to the danger of COVID-19. The risk remains when schools are closed. Even the schools are closed, the risk still remained because they like to go to the
These
private
cram schools, of course.
Cram schools cannot be and the risk cannot be eliminated even by thorough preventive measures. From the pandemic health risk point of view, it does not make sense to close schools while keeping a private institute open.
Right, I see. Professor Yi, what can teachers do then to better adapt to remote teaching to ensure that these children, as Professor Kang says, do not make their way into cram schools, but seek to take more online courses?
During the COVID-19 online education time, we experienced that teachers are not just knowledge delivery people. Well-made videos are easy to access, and even teachers are encouraged to use videos developed by other professors or teachers. The name teacher means a person who does teaching. And if teachers do not do teaching, what is the identity for teachers? So the teaching identity for teachers has to be changed. The new identity for teachers should come from teachers' expertise. Teachers guide and encourage students' learning. The specialty of teachers should come from the professional knowledge about their own students. The famous EBS star teacher does not know your own student. You are the person who knows your own student the most. You understand your student and you understand how to encourage your students in certain ways. So teachers should become learning coaches, and that is the new role for teachers in this online learning era.
Right. Professor Kang, given the COVID-19 situation worldwide right now, it appears that e-learning will continue in the autumn. What, in your opinion, are some ways to ease the gap in education given this scenario?
Yes, very good question. In fact, there are many ways to close educational gap. I think distance education grants access for all students to the same content. This is an egalitarian effect. However, as we discussed the social and economic situation of family and the quality of online curriculum by various offered by various schools can be the the big divider. So therefore, I need to establish. I think we need to establish the online curriculum platform. Where all students can acquire quality content and knowledge without discrimination. In addition, face-to-face classes should be tailor-made for the students who cannot cope with the online courses. I mean, the customized after online. On offline education, it should be tailor-made, I think. If online and offline don't complement each other, the digital gap will inevitably lead to educational gap. Right. So in addition, distance education, distance learning has to overcome quickly the one-way infusion type or lecture type. Because the teaching has to remain interactive in order to engage the students and the students among themselves, also online.
Right. All right, Professor Kang, thank you very much for your thoughts, and Professor Yi, thank you very much for being with us today.
Thank you.
Right, on that note, we end Thursday's edition of COVID-19. Do tune in tomorrow at the SAR as we discuss the latest research findings on the virus. In the meantime, do stay safe from the rain here in the metropolitan area and from the virus here and elsewhere around the world. Thank you for watching.